few years, the city has maintained this creative, innovative model that protects our most vulnerable residents living with HIV. We have reduced new HIV cases in the city to less than 1,000 per year, and we keep over 15,000 people living with HIV alive. 30 years ago, HIV was a death sentence. Today, it is not. But that is only true because of our leadership as a city and as a nation. Ryan White and CDC funding allowed San Francisco to build this impressive network, but it is fragile. It is like a tinker toy structure. Remove a stick here and remove a spool there, and it will crumble. What it is an amazing life-saving network of primary care, HIV testing, case management, mental health, emergency legal assistance, food and shelter that keeps people alive. And without this network, HIV will be a death sentence for our most vulnerable residents. Up to now, San Francisco has been a bold leader in HIV treatment and prevention, and we now find ourselves in a predicament. The end of HIV is within our sights, and yet the epidemic is not over. An $8 million reduction in funding will result in more deaths and more new infections. The city's new prevention plan relies on resources to test large numbers, to take care of those newly diagnosed, and to help prevent the further spread of the disease. How will we meet our ambitious city's goals of reducing new infections by 50% by 2015 without these services and without this funding? $8 million is required to keep us on this path and to avert a monumental crisis that will begin on July 1st. On behalf of the city's most vulnerable residents living with and at risk for HIV, I call on our city and our mayor to once again step up to the responsibility that is truly aligned with our city's values. San Francisco has been a leader, is a leader, and so let us lead. We have never turned our backs on the HIV epidemic from the 80s until now, and this is what makes me proud. If we don't take care of this problem, the city will get sicker. If we don't find the resources, our impressive tinker toy infrastructure will fall apart, and if that happens, there will be nothing that stands in between an HIV diagnosis and a death sentence. It will be the 1980s all over again, and it will be our fault. On behalf of all of San Francisco HIV service providers, we will not let this happen. Thank you.